We're going on right into panel 3.
Okay.
And this is what's called COVID impact on communities in general, a call for global social justice as a new focus to facilitate a healthier world. And Mary, do we have David's profile to put up? Mary?
Yes. Oh, Herschel is on. We can give a chance to Herschel.
Oh, okay. Herschel, you want to go ahead and start with Herschel?
Yes.
Okay. Herschel, thank you for being with us earlier and sharing your many words of wisdom and also your postings as far as chat is concerned. So we're going to kick off with you on this whole notion of COVID, its impact on various communities, and how do we bring about global social justice and a healthier world at the same time. 10 minutes, please.
Okay. Well, thank you. All right. Sorry, I did a switch over right here, and it doesn't. There we go. All right. We just held a workshop called The Return in Senegal. And we held it on health solutions, which Dr. E is going to present just a second. It was based on the backdrop of one, the African Union reached out to people of African descent worldwide in the African diaspora in 2012 with 5 projects, of which the most important in relevance to these conversations is the African Diaspora Financial Framework. This month, by the 28th of this month, we're submitting that framework based on over $298 billion worth of bank-based Federal Reserve community benefit agreements that are in existence right now. The biggest one with PNC starts in 1 January. Chase has already committed to Black and brown folk $30 billion. We're talking, when we had this seminar, and what we're talking about now is right now. And for the United States, as of right now, is that the United Nations, by September 13th, we're going to have a permanent forum on people of African descent, all 1.6 billion of us, versus the African Union's 1.3 billion in the United Nations. So we're in a unique opportunity here in America, based on the President's Executive Order 13985, to create solutions for the Biden 2022 budget based off of what he's executing right now, not only from the budget perspective, but from the American Rescue Plan perspective, where there's funding in that to create multilateral support. And we were on a conference call with Commerce on Friday, and they look forward to this group and others coming together to do this. And so when Mary asked us to add a session, I did this on the basis that we accept the idea that this group is working with the United Nations through Guy's organization on a peace track. We have just finished a session at the Indigenous Peoples Forum, which we're going to be publishing our letter to them and our cover and our work in the Indigenous Peoples Forum on April 29th, that deals just with these issues that you're talking about in terms of ethnic or tribal warfare. And we now have the platform in which to use that, because there's only 375 million people out of the 7 billion people represented in the Indigenous People Forum. But when this new People's Forum for people of African descent comes together, that'll be 1.6 billion people. So what we did in this Indigenous Peoples Forum is that we formed an Indigenous Peoples Alliance based on the work in the African Co-op that would represent 4 billion people. And the great thing about it is that here in the United States, that we can go to our federal government to leverage this based on being aware of what our government has the ability to do, not where we were 2 years ago, where we didn't know that the United States government was a signature to the Treaty of Berlin. So thereby we have standing. Not knowing that we didn't have an agreement and there was a process for an agreement with the African Union, and where the AU-EU agreement talks about migration, that we can talk about it as the most wealthy people of African descent in the planet. We have a GDP that's stronger than Mexico, even after COVID. And that we can bring to the table groups like the fellowship I'm members of in the African Scientific Institute Fellowship, who is ready to stand at the table to first make sure Africa is fed. Now, to do that, we've already engaged the USDA to do that, and Foreign Agricultural Service, and et cetera. So the platform framework is there. Now, we do reject rampant capitalism. We believe in the SDGs and the Global Compact and SDG 17 and a public-private partnership that has corporate social responsibility. The problem with Alexander Hamilton and the Wealth of Nations, it may have been good for colonial America. It may have been good for the United States then, but it was a problem in the second. Remember, there's 2 United States out of the Declaration of Independence. There is that which came about in 1777, which was failing, and that which is in 1789, which we operate under now. And Hamilton proposed this in 1791 to deal, yes, with those debts. But among those debts, okay, was the genocidal African program of operation of the United States of enslavement. And so within that context, we deal with that within the context of how we work with the United States around the whole issue of 1776, where earlier it was talked about that we don't talk to each other. Well, we can talk to each other by creating a common history, and we create that common history that is peer reviewed based on the
and
2018. I'm sorry?
Sorry.
I assume that was you calling me Mary. Okay. So that's based on, and I'm sure I'll give the rest of my minutes to Dr. E if he's on. Okay. But what we have proposed already to the United States government is that we conduct and create a history of 400 years based on the January 8th, 2018 African American Commemoration Act, which commemorates the first 20 Africans who landed in the English colonies that were going to become the United States at Point Comfort on August 25th, 1619 to August 25th, 2019. So that we have a commonality and we have an economic model, that economic model will show our history. And then we would have a model to stress test two different viewpoints, which is one viewpoint is rampant capitalism. One viewpoint is corporate social responsible capitalism, which is a difference, a world of difference between the wealth of nations of colonial America and the 21st century America that, if it wants to survive, has to partner with Africa and the Americas. Thank you.
You say that 36 seconds ahead. Thank you very much for that. Just keep going.
Okay, well, if you share it with me, I will see if you, can you see that?
Yes, go ahead.
All right. Let me, so Partners in Health is on the basis of a community worker model. And the whole idea of a community worker model, okay, let me just, yeah, okay. So you should be able to see that fully.
Yes, we can.
All right. It acts on the belief that the best way to guarantee high quality, dignified care is to rely upon and invest in local health systems. And again, what I was talking to you about in terms of this finance from America to put in place is in the process of doing that. And so the question becomes, what does building a healthcare system look like? All right. So, you know, we give requirements, but the key thing is that together with our groups, with the doctor is the health vice president for the World Conference of Mayors. And one of our members in our health task force is literally building a university healthcare system, a universal healthcare system for the state of Oregon. And so based on that and the work of the African Union, all that is required is the role of communities. And so you have to understand that even the best clinics and hospitals are insufficient in guaranteeing care if people can't access them. Now, when we talk about access in terms of transportation, one of the people who's in charge of that for us is the vice chairman of the regional sort of transportation. And so that's why community health workers are key to building strong health systems, because they have a personal relationship with the health consumer to make sure that, think of them as a concierge, a trained concierge. They are the bridge between communities and clinics, finding the most vulnerable among their neighbors and accompanying them through the care process. Domestically, we do that with the Cancer Justice Network. And Partners in Health has operations all throughout the continent that is based on this model. And often that care extends beyond the medical and addresses the whole patient. So domestically, on the call on Friday, like I said, with the Department of Commerce, which has the only agency that does business exclusively for minority businesses, and also has a comprehensive economic development strategy from the EDA. As they made aware, there's funding available. So when a mother cannot undergo cancer care and lose work without receiving economic support, and a tuberculosis patient cannot endure strong medicines on an empty stomach, and a patient showing symptoms of COVID-19 cannot take public transportation to her local testing site, then we put in a solution, which is a social work-based solution that is a trained local, the people in the community, by providing food to cash transfers, to transportation, to housing. Partners in Health stays true to its mission to do whatever it takes to ensure health is a human right for all. Now, we in our organization, FAU, we have adopted not only the SDGs, but a superset of them, as I mentioned earlier, in terms of finance in the public-private, utilizing the UN Financing for Development model. but is now implemented in Africa by the ministers of finance, the central banks, and a request for proposal. So Partners in Health delivers high quality healthcare where it does not exist and assures every person's right and ability to survive and thrive. PIH fights and prevents diseases by treating the whole person. So we have a unique opportunity to demonstrate this, building on the PIH, which invests in clinical education for its staff. As mentioned earlier, education is a primary factor to change the over 480 million young people's lives in Africa. And based on the work in the United States of competitiveness with China relative to the global infrastructure for 5G, we proposed December 3rd, 2020, our own version of a Belt and Road program from the United States. We now have the hearing to be able to do that, and through PIH, which advocates for national and global health policies that prioritize rather than marginalize. And so the whole idea of building this program around the Universal Periodic Review of Nations, which every nation goes through. The United States is in its process for its third round. We have two demonstrations other than the United States, Nigeria and Mexico. And so the whole idea is to stop it based on the fights of bias and dogma, and in terms of create rigorous evidence-based results that supports national governments and other partners in sharing its approach to equitable access for dignified quality healthcare. And one of the reasons that we had a participation in the Gambia was that the Gambian government, in a total of less than 90 days, built a 66-bed hospital in response to COVID-19, and that there's a whole range of services and support that we can do for evidence-based results. And the Gambia is also the headquarters for the African Union Human Rights Institute. And through PIH's University of Global Health Equity and its teaching hospitals, PIH prepares the next generation of social medicine practitioners and global health leaders. And like I said, I talked to my fellowship, the African Scientific Institute Fellowship, of over 2,000 hard science and technologists, which is inclusive of the president of Senegal. That, and combined with Partners in Health, will be able to deliver high quality health care because the technology behind it actually runs domestically. The Veterans Administration currently now serves 9 million Americans currently. And where it does not exist, that we can put in place, ensuring every person's right and ability to survive and thrive. And so it's a partnership with PIH, which fights to prevent diseases by treating the whole person, that we can invest in clinical education for staff and all kinds of health professionals based on an already established infrastructure in operation. And that advocates national and global health policies that prioritize rather than marginalize. And so the World Health Organization is one organization that has said that African continent will have a shortage of more than 6 million healthcare workers by 2030. The Black Folks Plan for Africa addresses that as part of what we call the return. And in terms of the transfer of wealth from people of African descent in the United States over the next decade, which is about $4 trillion transfer of wealth between intergenerational during that decade here in the United States. And for that, for the return of those, this is an executive order. And let me repeat from the United States position. It is an executive order. Now, I met with Senator Brown on Tuesday. And Senator Brown is the current chairman of the House Banking, Housing, and Urban Affairs.
Herschel, you have 1 minute left.
And so together that we can bridge the gaps, build strong systems, provide life-saving care that meets all the requirements that I heard today on a track that develops peace, that develops equity, that addresses biases, and that we can put in place based on adopting a superset of Agenda 2063, Agenda 2030 in the midterm review that's going to happen in the United Nations General Assembly on July 22nd, 2021. I look forward to working with all of you. My information is previously in the chat. Thank you very much.
Herschel, thank you very much. David, we'll get to you as a final question. I think Herschel did a very nice job presenting your organization. Dr. Mindy, you're here, correct? Dr. Mindy?
Yes, I am.
Okay,
Okay,
all right.
perfect.
Mary, if we can post his bio, please. And Dr. Mindy, why don't you go ahead and talk about your Global Hearts of Missions, please?
Global Hearts of Medical Missions is a project that's undertaken by a group of medical missionaries initially, but basically, and who have been coming to the Gambia since 1999. They built a medical unit in Gambia in 2010 until 2011. Unfortunately, they were kicked out of the country, but despite that, they still continued coming to Gambia because they believe that there's so much that can be done. And as a result, being a Gambian physician trained in the US, I met the founder and really the heart of the organization. And my promise was that we will make it happen. In essence, since then, we have a project called the Gambia Underdog Program for Health. It is really reimagining the health sector in Gambia by bringing together service, education, and workforce development. I've heard about, initially, Dr. Vivian was talking about the issue of human capital. And in healthcare, especially as you note also with Partners in Health, you cannot do it without building the next force of healthcare workers, not only physicians, nurses, but also allied health, and extending it to the community. Without the community infrastructure, there is no way that services, especially prevention and wellness, can have a larger uptake. So the idea of the Global Hearts of Medical Mission is to build the largest network of private sector hospitals ever in the Gambia, significantly raising the bar for national and regional healthcare quality, design in a way that will bring on academic care, wellness, and prevention and curative medicine in one area. But most important is to reduce the brain drain of trained physicians, because they will be trained in the country and end up leaving to go somewhere else. How do we do that? We do that in the sense that we don't only build in the urban areas, but extend it throughout the region. Result, we need to build one hospital in every division or region of the Gambia, in all 7 regions of the Gambia. And as I said, the guiding principle is around service delivery, education, and workforce. We will build in 260 beds across 8 hospitals and 2 academic centers, a senior living center to address the aging population. One of the biggest gaps that people don't talk about in most African countries is that as you age and not involved in economy, in income generation, you are almost discarded. And if you're a woman, you're even more discarded because the men have the opportunity to go back and be involved, not only maybe socially in the evening gatherings, in the gatherings of elders, but women are not. They are discarded, and sometimes they become a liability. And if their husbands passed away, really the care that they get is very, very minimal. How do we get their stories? How do you get their skill sets that they've developed to make it, to pass it on to the next generation? So that is also one of the reasons why we're looking towards a senior living center. Now, to do all of this, you have to do what I call implementation science, or the Public Health Institute, because we are looking for solutions. Someone was talking about in the call about building a COVID manufacturing. How do you do that without having the research infrastructure in place already in the country? You have to get the microbiologists. You have to get the engineers, the structural engineers, because the biomedical engineers. All of that skill sets have to come together. And when you have a biomedical institute or a research public health institute, you are likely to attain that. So to do an infrastructure like that, that covers the whole country, it has to be in an hub and spoke referral network. We know that 80% of healthcare needs only require primary care, which can be given at the health center. This model requires that many cases are treated quickly and are locally requiring less resources to travel to access healthcare. The community and the specialist hospitals are therefore reserved for the most serious conditions, freeing up capacity. And you use your tertiary hospital, which might be 1 out of the 8 that we plan in Gambia, to deal with subspecialty cares, to deal with once in a lifetime issues, for example, cardiology, orthopedics, neurosurgery, ENT. But for the general population, 80% can be taken care of at the health center and at a community level. Now, how can this be done? The biggest challenge with most health networks is that medical records doesn't travel easily. We are planning to have a networked electronic health record system. That means that every facility is connected to the national network. And also every patient has a unique identifier number that he carries out all over, and his or her record becomes accessible wherever he accesses care around the country. This cannot be done all at one time. We plan to do it in phases, where we get some of the major hospitals in the urban area up and running, the academic center to come on board, all the rural hospitals to come on after that as a third phase, and then the Public Health Institute, the living centers, and the wellness and fitness centers to come on after as a fourth phase. So this is hopefully, we are looking at an incremental implementation between 3 and 5 years. Andandor, the word Andandor means walking together. There's an African saying that if you want to go fast, go alone. However, if you want to go far, you go together. And the idea is to bring in local organizations, especially social organizations, in the communities that we plan to recruit from, or to build a facility to be an integral part of the medical program. The design, we are partnering with an organization out of the UK that have built a model hospital in Ghana, and not only Ghana, but also Zambia, Zimbabwe.
Dr. Mendy, 1 minute, please, 1 minute.
And their facility has been a WHO climate-friendly hospital model. 60 beds, 40 beds, 20 beds, and most important, the educational and academic facilities. I thank you for your time.
Thank you, sir. David, you're here with us now, correct?
Yes.
Okay. Looking at the presentation was made by Herschel. Out of that, what do you think, and just kind of going to what Dr. Mindy just shared with us, what do you think three are the three key areas that we need to look at for the whole of the African continent over the next 5, 10, or 15 years as the continent, as we say in the Emerald Planet, Africa fast forward?
Oh, how much time do I have?
Well, he's already taken your 10 minutes, so I'm going to give you 2 minutes.
Oh, I think I do have a vocal cord disability.
I understand. Do you want to have 1 minute?
I'll take 2.
All right, we'll give you 2. Got it.
The community health worker model that Paul Farmer and Partners in Health developed is definitely the way to go. I'm also with the Pan-African diaspora, and Dr. Dean, who is heading that up, says that the biggest challenge to COVID is getting the community to trust vaccination and the medical system in general. The community health worker model is going to be instrumental during COVID, but well beyond it, to build up trust at the local level. And we accompany vulnerable communities around the world with the model. In so doing, we turn to local residents, people who know their communities best, for leadership and expertise. They have been successful using this model for 30 years. They create an interface between the population and the local medical establishment, the politicians, the healthcare delivery system. And in so doing, they open up access and augment transportation. If I had 5 minutes, well, I'll just say contact tracing is being implemented immediately whenever a COVID-19 patient is diagnosed. This is what PIH is doing. It includes family members, but also workplaces, churches, schools, and other locations visited by a person with confirmed COVID. PIH is mobilizing networks of thousands of community health workers to find those individuals who have come into contact with COVID patients, advise them on the best ways to stay healthy and avoid infecting others, and safely accompany them to hospitals and clinics if symptoms worsen. Finally, for those contacts, social support, including food, water, financial support, is being provided by community health workers to help families in implementing social distancing. And all symptomatic contacts will be monitored for 14 days. So I'll conclude by saying this was an important illustration of how the model is being carried out in Lesotho, in Rwanda, in Sierra Leone, one other African nation. Our Partners in Health is always open to extending to new countries. I can supply anybody with information on how to go about contacting them. And again, this is a model that worked before COVID for 30 years, and we want to carry it on beyond COVID for another 100. Thank you.
Okay, thank you very much for being with us, David. Herschel, going back to you, 1 minute, please, is looking at the VA, what do you see as the 3 strongest attributes of the VA that could be carried forward onto the African continent that would actually be very helpful there?
So
1 minute,
number
please.
one is that we have the operating system that runs the VA running on our computers right now. And we have the source code. So we're actually working from Kenya to create a new user interface. So it's live right now. 2, the VA over the next decade as it transitions to a commercial project is abandoning this time-tested infrastructure that over 60% of Americans' doctors have been trained on. And so there's a whole infrastructure that we can transfer right now in training. Remember, I said 6 million doctors that they're going to be. So it's not a right now, we got to figure out and we can just transfer.
Mhm.
And the VA is going to spend $5 billion maintaining the system. So we could now have jobs in Africa that are going to maintain the system. And so we're IT people. And last but not least is that American veterans in particular can go back to Africa, take their benefits and plan unit developments like in the Gambia, so that if we have land, if you have 1,000 Americans who come back to the Gambia based on that, we figured their lifestyle would increase from living at subsistence level here in America to be living in a middle class that provides employment on a 5-to-1 basis. So if you have 20,000 Americans go, you're able to create 100,000 jobs, okay? But you're also able to create an infrastructure for the Africans who are around there, including training, because you're creating an American, it's Potemkin village, okay? And so, but you're able to do that on a right now basis. And we're part of a group that's doing that in Ghana right now. And so the win-win with Dr. E's program and ours, we just think it's a win-win situation.
Yeah, I think what you're talking about there, Herschel, and also Dr. Mindy and Dr. E, is the fact of you've developed this tremendous infrastructure in the United States, and because of these new rules and acts through Congress, and also the number of diaspora that really do want to go back to the continent, but are very highly educated, well-trained, and if they're veterans out of the U.S. military, they have real buying power, because many of these veterans have over $1 million worth of earned credit that they can actually tap into for investment. So
Exactly.
we're actually looking at these very people in Jacksonville, North Carolina, around Camp Lejeune, to do the very thing you're talking about, both in Jacksonville, but also go back to the continent.
But we'll contact you. I'm the Lieutenant Commander of the Ohio Command of the National Association of Black Veterans.
Uh-huh.
And so we're a VA VSO.
Okay.
Just like AMVETS and Veterans of Foreign Wars and et cetera.
Mm-hmm, mm-hmm, mm-hmm.
And so, this ain't it's going to happen in the future.
Right.
The doctor is in the Gambia, has the relations. Dr. E has the relationships. And the reason you hear me say Dr. E is I mispronounce his name half the time I say his name.
It makes it, I'm glad you did that, because it made it easier for me. So thank you very much.
Even though I used to be a diplomat for the country of Guinea to the US, we were the senior honorary consul. I used to live on the continent in Egypt. Okay, but I kept my mouth shut. Okay.
Yeah, well, thank
So
you for everything that you've been sharing today. And I've been seeing all the text messages that you've been putting in chat. So that's excellent. Dr. Mindy, one last question, and then I'm going to turn it back to Mary, because I think we have someone from Montgomery County Council that's going to close us out. But Dr. Mindy, for your Global Hearts of Missions, how do you see you're fitting in with this community healthcare workers, and then, of course, what Herschel's talking about, this very huge VA model? How does you see all of this fitting together, and what, say, one or two best practices that you think that is kind of the glue that can put all three of your organizations and your dynamic together?
Well, from the VA health model, I think the best thing we can use is the electronic medical record system is a result. For example, when you talk about Agent Orange, post-traumatic stress disorder, the reason why they're able to track this many number of veterans and also get their history through various wars is just because of the electronic medical record system.
Right.
They're able to go back and look people through time to kind of develop what has been the progress, what has been the effect. And this is where public health and population health and informatics come together in getting data for solutions. That's one. And then for the community health model, healthcare doesn't stop at the door of the hospital. If you look at almost all the healthcare systems right now in America, most of them are extending out into the community or looking at a local 330, a community health center, or a neighborhood health center, or an urgent care center. And shopping centers, they're all over shopping centers, for example. And that is really an extension of the community model, is to bring healthcare wherever the individual is. It doesn't have to be in the four walls of the hospital.
Right.
So those are two things. And who is the better person to talk to you than your neighbor when you're sick? Who can direct you to the next fairest facility? Who can appropriately take care of you instead of getting into a taxi or into a cart or a donkey and go to a hospital when actually there's no care there.
Right.
So you are being directed to the appropriate place to see the appropriate personnel to provide you the appropriate care.
Right.
That's what the community healthcare model does. And finally, we address the social determinants of health. Health is not only the hospital, it's the food you eat, it's where you sleep. We've had it through this conference about poverty, bringing that what was called as the hard infrastructure. Right. To expand the capacity and also the human capital that's what we have. And Africa has a lot of human capital.
Mm-hmm. Yeah, and it has a lot of traditional wisdom. And I think that's what's been coming out of a lot of this conversation today, starting with panel one and all the way through. There's a lot of this traditional wisdom that's out there that's been nurtured literally over thousands of years that we really need to tap back into and rediscover. So we talk about this, processing all these records electronically and having this vast network. But in Africa, you've had that vast network for millennia, but it's been through human contact to human contact. Yes. And so what we need to do is we need to match up the technologies and the Internet of Things and this human heartbeat that really is the whole of Africa. I've been over quite a number of countries. I've been to 98 countries myself, but quite a number of countries on the continent, and working there since 1976 in many different projects. And that's one thing that I've really admired is this pulse, this heartbeat that exists. And it goes across all 54 countries. It's not just isolated to one or two, but it goes across all those countries differently maybe, but it's still there. Mary, I'm going to turn it back to you. It's time to close up shop, I think. We're right on time. And do we have Mr. Tom
yes, we have
from Montgomery County Council?
Wait, before that, we are just closing with the Oh Beautiful, just to again bring back people to the July 4th celebration.
Oh, okay.
And Guy, are you on? Okay, perfect. We're good to go now.
Mary, what's the next step?
They are sharing, Guy is sharing the Oh Beautiful, the link for Oh Beautiful.
Okay, I can't hear it, but that's okay.
Because of, that's why we had to switch equipment, because I'm broadcasting on YouTube and Facebook. So the sound, and I have to increase the sound so that they are able to cover.
Right.
So we had to switch so that we don't get again echoes.
Yes, okay. All right, sounds good. Now we're right on time, so are we closed?
Are we going to be able to get a copy of this, or we have to go to YouTube?
I think you'll be able to get a copy. Is this Herschel?
Yes, it is.
Okay, I think Mary's going to make everything available. That's my understanding.
And follow-up conversation at 8 o'clock tonight on July 4th. We appreciate Mary for inviting us, but our normal 8 o'clock is our July 4th. Tonight's
Okay.
in the chat.
It's like what happened to me.
Mary, anyway, I want to thank all of you of panel 3. It was excellent conversation, wonderful dialogue.
That's what happened to me.
Good information. And so Mary, where are we? Are we closing out now? Mary, you're muted.
Giz, you take it off and I try here. It's not being played. It's the same way.
Okay.
Yes,
weekend panels information. I think we've done some actually really good networking through these 3 panels that can go back through the Watch Democracy Grow as an organization. I'm Dr. Samuel Lee Hancock of Emerald Planet TV, and also Rotarian through the Rotary Club of Washington, D.C. in the United States, in Rotary International District 7620. And Rotary is expanding like wildfire across the African continent. And that's another resource and asset that everyone here needs to think about and to utilize in the future, because Rotary is expanding in many of your medium-sized and smaller towns. It's a tremendous asset, every community that it joins. And thank you to everyone for being with us. So Mary, if you'll take us out, I'm finished.
Okay. Let's see if we can be able to play one song and then wind up.
Okay, you got it.
I hope we do. Okay, excellent. I can't thank this no more.
And thank you, Mary.
Oh, beautiful for spacious skies, for amber waves of gray, for purple mountain majesties above the fruited plain. America, God shed his grace on thee, and crown thy good with brotherhood from sea to shining sea. Oh, beautiful for patriotry that sees beyond the years, finality
On behalf of Watch Democracy Grow, now you can see why we run. 10 minutes, Mary's on the door, 10 minutes. We tend to lose people when we stay longer, especially people who are having just their small amount of time. So when I rush, it's not because I am pushing, it's because I'm trying to at least to incorporate everybody that wants to be part of the celebration. So I can't thank all the panelists enough. On behalf of Watch Democracy Grow, we want to thank you so much. Happy July 4th. And celebrating the independence as new Americans does not mean that, because I know immigrants tend to have that challenge. And that's why actually we were like, we had planned this 2019 in that we joined the parade. But then COVID came, we couldn't be able to join the parade. Then 2020, still it was the same challenge. So we said, you know what, we are going to do it on Zoom. The essence is to encourage immigrants to be part of the culture. When you are holding the American passport, you are holding that nationality. That does not mean that you don't, you're not proud of your origin, no, but you have that nationality again, you are part of it. I'll share my experience when I was traveling on that same passport the very first time in Europe. I was on a train moving from Stockholm going to southern Sweden. And I was seated reading a book, and there was a person next to me. He said, "Where are you coming from?" I said, "I'm from the States." Then immediately he said, "Aren't you scared of traveling as an American?" That had never hit my mind. And I was like, I was sharing with Dr. Hancock that really I wanted to jump out of that train. I was so scared because I had never imagined that. I said, no, I'm not scared, because when you inherit a country, we inherit its triumph and its tribulations. So as on behalf of the immigrants who are part of the community, we are not becoming Americans just, we are becoming Americans, part of the culture, and to add where other people have already. In other words, how can we bring our bricks to this great nation? What can we add there? It can be social, it can be political, it can even be economical, only that we tend to think of only economical, which is, again, remember, when you go and relocate yourself to another land, the first thing which comes in your mind is, how do I survive there? That's why economical come first. But then you have even other intrinsic values that you inherit from a country. For one, I was born in Uganda. When I could sing the national anthem of Uganda, you would think I was a Ugandan, but I was a Rwandese. So basically, the culture of celebrating independence, it's something that I have learned from the school. I have not maybe given you my bio. I majored in political science and background in public health. I am a community developer, and I'm the coordinator of Watch Democracy Grow. Because I was working on a laptop which could empower on all these kind of things, that's why the video was a little bit muted, so that I can be able to multitask. Otherwise, the whole of my privacy would also be out there, whether I'm putting out a paper, whether it is falling. So that, for that reason, that's why I had to turn off the camera, and I apologize, and I hope that you didn't take it personal as an offense. It was just one way of being able to multitask on this event. So we can't thank you enough. And Dr. Hancock, always, you are our best. Remember, accents are part of the community. Mm-hmm. Name misspells are part of the community. I no longer own my name. It's usually called Uwera, but I'm you. And I have gone for it, and I'm so happy with it. So no bias, no nothing. It's part of the culture still.
Yes, exactly.
Yeah.
Okay. Well, thank you very much, Mary, for everything you did. Thank you for all the panelists. Thank you for the videos that we've actually shared through the registration. I think that will go a long way in the future. And I think it's time to close. And happy July 4th to everyone that's here, and to all your families and extended family all around the globe. And thank you
Thank
very
you.
much for being with us on Watch Democracy Grow. Take care
Thank you.
and God bless. Bye-bye.